Thank you very much, Sue. Thanks for that introduction. And good morning, everyone all over the world. And we have been introduced already, so I won't be introducing myself again, but hopefully we will have a great time together, just trying to explain some of the things we did during the pandemic with you. And like Julia have actually put a lot of things into perspective, and some of the things and some of our findings will actually be complementing what Julia found in terms of some of the things that we had that the women are saying, and then some of the things that the staff are feeling. So I'm going to start with a sort of like what really happened. Why did we do this? During the pandemic, yes, as I was being introduced, I was the director of midwifery at Bartels, and that's the largest maternity unit in the UK. And I'm always proud to say that it's the largest maternity unit in the UK. And we were in East London, and that's one of the most diverse organization one, and also the kind of people we looked after are also very diverse in terms of ethnicity. So the pandemic started and everybody was worried. And we all know the story of different information. Everything was just flying in. And initially we were concerned about how women are getting the information, especially the people that live within East London. However, I think one of the things that then struck us was initially there was that information about COVID will not affect pregnancy. And everybody was focusing on ITU care. Suddenly we started having pregnant women sick. And then we had a mortality in the community. And I think that for me, that was where I was so worried. I was in a trust where we have mortality in the community. And again, this is a sort of like an ethnic minority woman that have actually tried to contact the service to say that everybody within our household was showing COVID symptoms. Obviously, the message then was stay at home. And again, the information and the sort of like advice given was stay at home and call 111 if you are sick, if you are still not well. And that time, I think that was just what the information was at that time. So by the time the woman actually called in to say, look, I am sick, and the husband was on the phone by this time, it was a bit too late. So by the time the paramedic got there, they were performing perinatal section, cesarean section in front of the family. Unfortunately, we lost both mothers and the baby. Obviously, that didn't go well. And that really, really then brought the whole issue about what can we do with our community. And then when we then start looking at what was going on the TV, obviously we have a lot of our staff as well that were sort of like being affected as well. And if we then start looking at what was going on, and the people that were highly proportionately affected were people from ethnic minority group. We all know the narrative, and it wasn't just in the UK, it was all over, especially as well our other country, which is the USA. So at that point, we just felt we need to understand what the experience of the staff are, and also how can we actually look after our women better within within East London at that particular time. And that was when this project started. So the project itself, the background of it is that most of the time there are a lot of things out there in terms of ethnicity and every other things that are there. However, with this project, this was the first time we had the Black and Asian ethnic minority group. I know I still left BEM on my slide, and I know they've abandoned BEM. So please forgive me today, because I just don't want to change that from my slide. So Black and Asian ethnic minority group, there's been a lot of focus on that over the years. However, what this has done in terms of COVID is just to shine the light on those things that we've been talking about for years. And what also happened during that COVID time is that some of the things you're going to hear it's not going to be comfortable, but I'm just going to say to you, please bear with me, because again, I think by the time I finish everything, you understand the fact that when we talk about inequalities and so on and so forth, and racial discrimination, I think we should all get into that stage whereby we are comfortable with discussing it openly and trying to actually change what is going on. And it's not about pointing fingers or blaming the system. It's about what can we do to change the narrative of what is going on. So looking at the TV, there were a lot of things, and a lot of people that were coming on the TV talking about PPE and all this kind of thing are also like from the white community. And it looks as if there are no Black people at all working at that time in the healthcare system. And for me, when we then were thinking about putting this together, I thought, okay, fine. I'm sure we still have head of midwifery that are actually leading maternity services. And for the first time, I reached out to the head of midwiferys across the country to say, look, the people that I remember that are sort of like from Black and Asian community, and say, can we join up and then do this project together? And by the time we finished that, we found out that it was only about 7 or 8 of us in the whole country. In a country where we have over almost about 200 maternity services, whether as a sort of like standalone or not. And you just found that, again, that actually brought it to light that there are issues going on here. If in the whole UK, you only have about 7 to 8 Black and Asian head of midwifery. And if you look at my introduction as well, when I then actually got the director of midwifery job, then to just realize that I was the first from Africa. And I say Africa, not the first Black, because people made that mistake and say first Black. No, they've been Black head of midwifery far before my time. But it's just the African origin bit. Again, that is just about really explaining what is going on in terms of inequalities that we are talking about. So we began the discussion, we decided what we're going to do, and then we pulled ourselves together and we wanted to do something about what was going on. So some of the things, like I said earlier on, is just about the impact on that Black and Asian communities. And then we wanted to find out, we developed about initially 4 key lines of inquiry. And while we are doing this between April and May, we had the death of George Floyd in America. Obviously, that's like stir up Black Lives Matters. So whatever we wanted to do there, we thought, okay, as much as we are looking at maternity, we have to look at race and the issues around race as well. So that at least then we are current in terms of some of the thinking and some of the things we want to be asking people. So we developed 4 key lines of inquiries. So the first one was to look at the challenges that the staff face, that from the community. And also as a member of that community, what are the social cultural factors really affecting the community that makes us susceptible that much to coronavirus in terms of COVID-19 infection? And then as a member of the BM, Black and Asian Ethnic Minority Group, what else can we actually do to actually change the narrative? How can we improve the care for our women? What is it that is affecting women, and how can we really support staff to do their job effectively? And really, when we were talking about this, we know that there've been a lot of reports out there, but we wanted to make sure that our report is more or less action focused, and we don't want people to come and moan and complain and say, okay, everything is wrong about the system. So on every of the forums, we actually ask people, okay, what can we then change now? How can we then do something now? So that at least people come with the fact that we are not coming to sort of like attack the system. We don't want to attack the system. We want to create solution. And that was what that group did. And we are still carry on doing that. So, like I said, our approach was we actually brought up the objectives, and one was to look at the challenges that face people, look at the support that Black and Asian community needs. How can we enhance and change and manage misconception? Again, probably when I go deeply, you understand it. When I talk about misconception, I'm from that community myself, so I can say a lot of things myself without being accused of being racist. So that's the beauty of me presenting this. Because again, there were a lot of misconceptions. There was a lot of concussion prescription on WhatsApp and everything else. And obviously, I've got a call from mom and friends and say, okay, have you mixed your ginger with lemon, with lime, and all this kind of thing? So there were so many things going on within the community at that particular time. And some of the things I'll be talking about as well is about how our community, how do we engage? How do we relate? How do we do things? And I think those are the things that people still struggle with, to understand that the way we engage, the way we do things is quite different. And it's about how do we sort of like reach those communities. And the final thing was to look at that social cultural influence on both staff and women. So, like I said, our approach was more or less like a qualitative approach, and we did 11 forums. And the 11 forums that we did, people were able to express their feelings. We actually make it a safe place for people. And what we wanted to do was not just to hear from the senior people. We have people ranging from band 5 to band 8, bank agency, maternity support workers, and student midwives, really. And also, what we found out is that because a lot was going on, a lot of people are under pressure. Some people could not come to the forums, and they did ask for us to send a survey out. We did send a survey out within 1 week before the closing of the whole project. And we had about 132 responses. And I'm glad to say that some of the responses are from doctors as well. So which shows actually that the issues are not really from just midwifery point of view in maternity. It also affected the medical groups as well that are from the same community. Obviously, that time as well, when we were doing this, there was a lot of issue around risk assessment of Black and ethnic minority people and that PPE issue across the board. So what we did was to do that extra forum to actually concentrate on those two issues. So some of the key findings are this. The report is out there, and I'm sure if you Google Turning the Tide, the same headline, you will get the report. And it's a lot. There's a lot of things that we actually brought out. But I'm just highlighting some of the things that we thought there are common trends across the whole findings. And I'm sure we all know that we all know the narrative that everybody was so scared. Everybody was like anxious. And I think one of the big issue was that psychological impact of COVID on people. And then by the time people start getting later to self-isolate and so on and so forth, people are really, really scared about what was going on at that time. And also there was that thing about trust. Trust is a big thing. And I'll talk about it later on when I talk about vaccination and so on and so forth. Trust is a big thing. And I think that's one thing we really need to continue to work on going forward. Trust, the lack of trust is not just from the system alone, also from ourselves, even within the work environment, which makes it a bit difficult because again, you find that some of the issues we find out when we ask people why are they not engaging with the risk assessment. Well, Black and ethnic minority people are the most affected, and then we are not having risk assessment done. It doesn't really make sense to me. The same thing as what we are seeing with the vaccination as well now. So when I then ask people, why is it that you are not doing your risk assessment so that people can look after you? People just don't trust the system. It's about trust, and which is a shame, really. And for me, these are the things, when I talk about this, I balanced it up. When I talk about it, I talk about the system, I talk about Black and ethnic minority group as well. We need to deal with our own issues too. And we really need to start thinking about changing the misconceptions we have about the system as well. I think it's both ways. I agree that the system might be racist, but we have a role to play in this. We have to engage for us to change what is going on. By not engaging and saying we don't trust the system, that means nothing will happen. And I'm sure people have heard me say this over and over again. And there's that bit, and I've highlighted some of the key areas. So you can see what was going on. When people, you can see why people said they don't trust the system. One of the participants was very clear about this. This was a direct quote. I was made to feel I was being a time waster, and I was going off sick for no reason, and she didn't. So this is a communication between a staff and a manager. Again, these are the things that actually make people not trust the system, and people sometimes don't want to say anything. Whereas it's not the right approach, or people leave things too late. And honestly, when we talk about 5 times more likely to die about women, 4 times more likely to die among Black and Asian community, again, these are some of the things, because people are really scared, and sometimes people don't want to say things out early, and then they don't engage with service on time. And by the time they get to the service, sometimes it can be a bit too late. So I just want to sort of like mention that. So just to carry on, some also feeling that actually they felt, and these are the people in terms of midwives going to client's house or women's house. Some people are really, really scared, and it's just the fear of contacting COVID and so on and so forth. And midwifery student reported feeling fearful of taking up a placement because of the information they got from the media. Again, this had from the student midwife and some of the agency midwife. Oh my God, the agency midwife thing was an eye-opener, because what they felt is that, and this is even before COVID, It's just because we are not paying attention to what has been going on with bank and agency midwives, especially the agency midwives. It's the fact that they just don't understand what was going on. They are trying to sort of like still come in and do their job and help the system. But still, they found out that actually, they don't get the right information and so on and so forth. And they feel that they don't feel treated equally like the substantive staff. So the key lines of inquiry 2, this is the second part of it, when we then ask people about what do they consider as the key factors, that why is it that Black and Asian community are the most affected. And these are the things that they've said about what they feel is going on at that particular time. And I know Julia did spoke about virtual clinic, and I think and I know Julia spoke about virtual clinic, and that is the general population. Can you imagine somebody that cannot even speak English, that doesn't even know what to do, and that doesn't even have money to buy top up on their phone, talk less of having an iPad. So again, if you then think about that, then the cultural differences of actually sitting on the iPad in the house, and some of the things are hard. Don't forget. And I think those are the things that we don't really realize. So that already we know that there's a lot of health inequalities going on. There's a lot of deprivation going on across the patch. What then happens is that the schools are closed, the children are in the house, there's homeschooling. Some people live in a house that is only one room, and you have the mother, father, and the children living there. So that everybody is competing with maybe one desktop or laptop that is in the house, because the children has to log in for their schoolwork, and then the midwife is also coming to make an appointment with the mother. So these are the things that people are not really putting into perspective, that people might not have that privilege that other people have, and people might think everybody is the same. Virtual clinic is actually not just for everybody because of other intersectionalities that are going on. So it's not just about culture and race alone. There are other things like deprivation that is actually affects those communities as well. So the other things as well, and I think this came out loudly, was about racism. That was so big in the issue, and people were just sort of like so angry. And also with the death of George Floyd and Black Lives Matters, there was a lot of anger that came out. And I've actually sort of highlighted, this is a direct quote as well. I'm sorry to say, but in my opinion, the system of oppression actually is the causation. They feel that there's that systemic racism that has been in the system for a long time, and COVID is just sort of like magnifying it. And the next one is also talking about how do we improve improve care, and thinking about maternity care for women. Again, there was that concern about that virtual working and so on and so forth, and the incidence of domestic violence, and a lot of things that were happening at that time. And it's about just really thinking about one size does not fit all for everybody. And I understand that everybody, the whole system was trying to do their best to meet the needs of majority, but actually some people actually did suffer through this period. And that's just continuation of that key lines of inquiry. And one of the areas that also that people are struggling with is in terms of antenatal screening. And we know that things like sickle cell, thalassemia, and hemoglobinopathy, people need to actually access with the service right on time in the beginning of their pregnancies. And honestly, from my trust, because I look at the data, we had a lot of women that actually did not come in because everybody was afraid of it and people didn't get that done. Even when actually there was provision for people to access the service, people did not come. And so again, a lot of people did miss some of their screening program, but hopefully we were able to mitigate that. There were a lot of sort of like risk assessment done later on when the pandemic was a bit easy. And the last thing was, what do you need to do your job effectively? Again, there are tons of things that people came up with, or in terms of what we can do to really support them in actually making things better. And one of it is the one code that we put there. One of the biggest challenges that I am facing is supporting staff with their mental health. So there were a lot of issues about mental health and how we can support staff with their mental health. And there's a need for management support to deal with this. So again, mental health was a big thing that came out throughout the pandemic. Like now, the risk assessment team, when we were like so worried and say, how come people are not engaging with it at the beginning? You can see what people say. And they just like, well, they just think these things are tick boxes. And honestly, majority of things, that's why people don't trust the system. They just say, okay, they want to tick box, they will tick box, and that's it. It's vague and unclear. It's actually useless, and some people think it's a joke. Again, it's all boiled down to not trusting the system, not accepting that the system will actually help them in doing anything. And then in terms of PPE, again, there's a lot of issue around PPE before we then got to the stage of thinking about the anatomy of the face and so on and so forth. But I would say this, all these things that we talked about was during the first wave. Obviously, the government did a lot of good work. We did have a lot of PPE. We did have a sort of like people had their risk assessment done. But this was just in the thick of pandemic when we were doing the project. That now at the minute is not the same story because a lot of things have changed for better. And then the findings continue. I'm not just going to talk about this because I'm conscious of time. We then move into recommendation. And you can see the first thing in my recommendation is self-care. And I cannot re-emphasize this enough. All over the world, if you are hearing my voice, please, it's about looking after ourselves, looking after each other, checking on each other. And one of the things that happened during pandemic is a colleague of ours as well that actually passed away at home by herself. Again, this person lives alone. They call, and when we did not see them at work, unfortunately, she's a doctor. We didn't see her at work, and we are the one that actually contacted the next of kin and said this person did not turn up to work. By the time the police got there, the person is gone already. So for me, those are the bad memories of COVID-19 that actually stuck with me because that really shook all of us. And again, it's about checking up on each other, by really looking after each other. And I know COVID has brought us more together, but it's about how do we just do that more. So again, in terms of the second recommendation is about how do we support each other through mentorship to actually sort of like improve in terms of giving people equal opportunities and so on and so forth. The second thing in terms of our recommendation is about support for staff that are from the community and how do we advance their career. And I've really written some things there as tips. I'm not going to go through them one by one. So if you really want to read that in details, please do go and look at our report. In terms of also in workplace, what can we do differently in workplace? There are a lot of recommendations, and these are some of the recommendations in terms of having Black and ethnic minorities speak up guidance. And I'm happy to say that some trusts have taken this up. They've got Black and ethnic minority speak up champions and so on and so forth. So a lot of things have improved from the time this report was released. And one of the biggest things also is about having Black and ethnic minority representation in some of our group or some of our regulatory bodies, so that at least that issue, there will be that diversity of learning, diversity of ideas across the board. The next one is about how do we hear the voice of the Black and ethnic minority women. That is the big thing, because I know a lot of people do survey, a lot of people do focus group, but these people don't engage that way. There's other ways of engaging people. And I talk about this when I talk about music. Music is a different thing. And I know people say it's Africa. It's not just Africa, including Asian. People dance, and we are used to actually using our hand and body. And there's that thing about music. So there's a way of reaching the community in terms of how we campaign. But the way we campaign at the minimum, not just to be the right way. And that's why people are not engaging. So there are other ways that we can look at it. And our group is looking at how can we actually help the community to understand how to engage with this community. Those are some of the work we are doing. And also to say that, and I'm glad to say during the second wave, there was that clear message about staying at home doesn't mean staying away from care. So again, that message was changed quickly. The third recommendation is about understanding Black and ethnic minority people. Again, there's a lot of work we are doing. If you ask people, where do you get your support from? Would you respect within the community? Who can you actually confide in? Honestly, I'll tell you now, it won't be your midwife, it won't be your doctor, it will be your church or the mosque or your pastor. Again, this is not to blame that community, because that is how we are wired. That is how we are raised. No matter how educated you are, you respect your pastor. Again, this is where we have to then think about, if we're going to do health promotion and all those kind of things, how do we use those people of influence to those community to reach the communities? And I know people are doing it, but again, it's about how do we do it in a more coordinated approach. And there's that thing, like I said, about traditional herbal remedies. A lot of WhatsApp messages on ginger, on lime, on pineapple, and so on and so forth. Again, these things have no dose control. And that's why we reach back to the community and say, be careful of this, because because nobody knows what is in that, and there's no close control. There's no evidence based on that. And there's that issue about vitamin D and so on and so forth, which again, I'm glad to say this relates to what the Chief Midwifery Officer have done in terms of imposing that or encouraging people to take vitamin D on a regular basis. So this is also an aspect of it where we look at how do we sort of like provide and support people with high maternity care. Again, I've spoken about virtual working, thinking about the pathway, and actually using people from the community to support the community. That is what it is done in most of the developing world. And why can't we do it that easily here? And the last thing is about understanding the body. Again, there's that thing about anatomy of the body, and how do we, when we really want to change this narrative, it has to start from training. And I will say to you now, when I was in Nigeria, my favorite textbook is Margaret Mice. And actually, I'm in Nigeria, and they're teaching me the anatomy of physiology of somebody, of the white women. How can that be? Whereas the skin texture and everything is different. So if we are going to change the narrative, we have to start from training and changing some of the things in the evidence and the textbook that we have at the minute. Risk assessment, I've already spoken about that. I'm not going to really go into that. So we summarized it, things that we are looking at present into 5 key themes. The first thing is about how do we increase leadership across the board, looking at our regulatory bodies. The second thing is about that curriculum that, as I've rightly said. The third thing is about how do we improve career and give equal opportunities to people. And then the fifth thing is about how do we sort of like risk assess so that people can actually, the people that need that 75% continuity of care do get that continuity of care. And the fifth thing is about how do we then promote and really reach this community widely. Since the report was launched last year, October, it's just to give you some of the things we've done. We've got 7 work streams that is working on different aspects of this, and you will be seeing more of some of the output from the group. Like I said initially, we don't just want to be a talking group, we want to be an action group. And I cannot really finish my slide without talking about some of the topical issues about vaccination and things that are going on. And I know things are changing on a daily basis, things have improved, but the picture in the UK was that, like I said, it doesn't really tally with me. If we said the people that are most affected are Black and ethnic and Asian minority ethnic group, and then we are not engaging with the vaccine. Again, there's a lot of things going on in terms of information that is going on within the community, and it's very powerful. We do things by word of mouth. It's not by poster, it's not by leaflet. It doesn't work for that community. So again, it's about understanding that. The biggest thing again is about trust. And I'm not going to go into that because I've spoken about that every time. When we ask people, again, it's all about trust. And just to say to you now that if you look at this is from an American slide. If you look at people that will totally refuse, it's only few of them. The people that we need to convince are the people that sit on the fence, they are not really sure. And those are the people that we really need to talk to. All we need to do is to change that narrative and change the information. And I'm just going to show you some of the things, how we've been helping out from our group. We've actually had some seminar to actually help to encourage the community, speak to the community, and actually talk about using evidence-based rather than just using any information that you pick up on WhatsApp. Again, these are the things we've done. We've done women forums where, again, we talked about vaccination. We talk about other things that really bothers the community. And what we are doing now is, again, when we really want to really make sure that we actually look at mentorship and how we actually change the narrative. We are doing a pilot program now at the minute with RCM, and we've got about 62 people, expression of interest for us to be able to sort of like pilot that program that we are doing with Black and Asian community. And if that works, it will be going for all the general population. Again, we've had forums on terms of career development and what people really want for their career development. Again, we've got all that narrative and we are working through that with capital midwives in terms of how we actually do that. And when I talk about capital midwife, I will actually talk to capital midwife. Capital midwife is London, but what we said to them is that actually make it a bit open for people that are not in London as well, so that people can benefit from it. And they are looking at that. This is a tool that we are developing in terms of how we actually look at sociocultural pre-booking screening tool for people from this community. And mainly, this is not your medical screening tool. It's about the issues around the community. And these are developed by multidisciplinary group. And we are still working on this. It's not finished yet. And we've been engaging with a lot of different people. I'm not going to really go through that as such. I've already mentioned a few people that we are engaging with and where we are in terms of the work we've been doing. And in terms of next steps, these are the things we are doing, and there's going to be a sort of like a 6 months on into the project where we'll be able to talk elaborately in terms of some of the things we've done. And that's me done. Thank you very much. Thanks for listening to me. Thank you.
Gloria, I feel quite breathless. That was fantastic. You've covered such a huge amount, and you're obviously a very busy person. And one of my questions was going to be, are you going to be doing a follow-up? But it sounds as though you've already weaved that in, and you're busy getting that underway. And I love the fact it's very much based on action, because I think a lot of people have said, we've known this stuff for a long time. We talk about it and we don't actually do anything. And I think what your presentations really hit me is the action bit of it, you know, and actually not just apportioning blame, but addressing it and getting some action going. And I love the idea of the mentorship and the leadership of this is really fantastic. But will you be doing a follow-up, do you think? To kind of compare, and I mean, I can imagine you'd want to do a sort of serial follow-up just to track through the impact of what you've been doing.
I think there's so many things that have come out really from it. So yes, definitely we are doing a follow-up, and all the things we are doing, we are weaving evaluation into it, because again, it's about evaluating it. And like with the mentorship issue, we actually thought about what would be the best thing to do. And we don't just want to make it a London thing. It's Turning the Tide is a national thing. It's not just a London thing. Absolutely. And that's why we are working with RCM, which is a sort of like a national organization, to actually see how we can collaborate and actually make this a reality. Like I said, if it does work for Black and ethnic minority staff, then it will be available to everybody, because I'm actually a great believer that everybody will benefit from mentorship. It's not just a certain group.
Absolutely, absolutely. I mean, I think there was so much in, and I have to direct our audience to the report, which is excellent, and it's very readable. It's got huge impact, and I think we can all learn from it very much. So do go on, and you'll remember it's at the beginning of the give us the word again, Gloria, where we get the just put in, actually it's easy, you just put in Turning the Tide into Google and it'll come up and you get the whole PDF. You don't have to register or anything. It's all there to see, and it's very readable and very useful. I mean, I suppose I know that those of you who are listening, if you have any questions, remember we've got a little bit of time at the end of the morning to actually ask Gloria a particular question. So in the meantime, Gloria, I'll say a big thank you to you for putting such a huge amount of information for us. Lots of things to think about and reflect on. So thank you, Gloria. Okay, we're now going to move on to our third session of the morning.